bureaucratic care theory, BCT, is a grounded phenomenological theory that describes the categories of caring and their relationship to the human lived experience. A grounded theory approach is a qualitative research method that uses a systematic set of procedures to develop an inductive theory of a social process. One of the major assumptions of BCT is that nursing is holistic, relational, spiritual, and ethical caring that seeks the good of self and others in complex community, organizational, and bureaucratic cultures. Health is related to the way people in a cultural group or organizational culture or bureaucratic system construct reality and give or find meaning. Primary care is geared towards health promotion, disease prevention, and management of chronic diseases such as diabetes and hypertension. Nurses, by virtue of their roles and responsibilities, are experts in advocacy, practice, and communication, are ideal for primary care practice. The application of BCT in these areas opens new opportunities to advanced practice nurses to showcase their skills and expertise in patient-centered care. Primarily, articulates community health trends and advocate resources with credibility and professional influence. Advanced practice nurses are innovative and people-oriented. These professional characteristics enable personalization of a patient's healthcare and adaptation of evidence-based practice at all levels of the healthcare system. Advanced nurse practitioners apply knowledge gained from reviewing resources, working with experts, and conducting training.
Process of development and concept formation. The theory of bureaucratic caring was generated from quantitative study that involves patient and health professionals in the healthcare center settings. The aim of the research was generated a dynamic structure theory in complex organization. The researchers used ethnography, grounded theory, and phenomenology methods to determine the meaning of the caring to explore participants. Ray discovered that bureaucratic caring started as substantive theory, carrying data from experience, and then evolved to formal theory, integrated synthesis of bureaucratic and caring structures, and argued that meaning of the caring tends to differentiate itself in relation to context.
Discussion number 4. Distinguish between philosophical theories and models. The theory of bureaucratic caring, BCT, has been classified within a variety of perspectives, from philosophical, metaphysical analysis of caring to caring as universal, spiritual, ethical, love, and co-presence as the essential nature of nursing. The bureaucratic caring theory, first, is a universal theory of nursing. Second, the bureaucratic caring theory is classified as a grounded theory, generating from research in the social context of a hospital, focusing on the meaning of caring and practice, with the discovery of substantive theory, differential caring, grounded in meanings of role differentiation and work unit experiences in the complex organization of the hospital, and then synthesized as formal theory. The bureaucratic caring theory advanced from the Hegelian dialectical argument of the thesis of caring as spiritual, ethical, humanistic caring in relation to contextual data of the social culture of complex healthcare organizations and historical data of the meaning of bureaucracy. In summary, the theory of bureaucratic caring emerged using a grounded theory methodology, blended with phenomenology and ethnography. The initial theory was examined using the philosophy of Hegel. The theory was revisited in 2001 after continuing research, an examination in the light of science of complexity and chaos theory, resulting in the holographic theory of bureaucratic caring.
Discuss the pros and cons of using technology in nursing education. Pros: improved communication leading to improved patient care. One of the most significant advantages of technology in nursing is that tech make it easier for nurses to communicate with patients. For example, if a patient has a minor health concern like a rash or a bruise, they can use technology to either video chat with their nurse or doctor and speak face-to-face without having to be together in person. This element allows the nurse and patient to talk freely so that any concerns may be heard and all advice and directions can be given. Better education. Technology is transforming how nursing is taught. With the help of technology, teachers can connect with their students in new ways while providing them with professional contact resources and personalized learning exercises. Technology revolutionizes the classroom by making communication research and resources easier to handle, whether taking nursing education online or in person. Nursing students access excellent new tools like live and online simulations, applications, reference guide, textbooks, virtual classrooms, electronic training, dummies, etc. Improved treatment. Over the decades, tons of technological advancements have changed the face of nursing care and patient treatment. Nurses can communicate with their patients better, but technology has improved treatment. In a list of technologies that change nursing forever, some tools like electronic IV monitors, the portable defibrillators, hands-free communication options, and drug management technologies are just some of the new tech tools that have transformed the efficiency in treatment and nursing care. Better kept records. One of the most dangerous things about healthcare without technology is keeping records manually. Whether the stats and health data of patients were written out manually and stored in a simplistic way like in folders and filing cabinets or online spreadsheets, the risk is always the same. Data can be lost, damaged, stolen, or vulnerable to issues of time like yellowing paper, smudged or fading handwriting, stains, rips, and more. Electronic health records allow healthcare professionals to keep track of patient stats and data simply, accurately, leading to fewer medical errors and better quality patient care. Information is saved securely and efficiently accessible, making it simple to find its specific data, notice patterns, and more. Next, cons. Set up and internet access. An essential disadvantage of technology in nursing is that some patients may not be savvy with technology. Some patients may not have mobile phones or internet access, making application and video visits useless. While this may not be a total disadvantage, it is a significant barrier that nurses and other healthcare professionals must consider when using tech to revolutionize patient care and interactions. Malfunctioning equipment. One of the biggest headaches of technology is what happens when technology doesn't work. Technology may be a valuable and efficient way to make life easier, but it can derail the whole day when it fails. This is especially true for organizations that rely on technology for almost all their operations. It is essential to ensure that you have someone ready and accessible to fix any technical problems and a backup method to provide patient care. At the mercy of the server power. Another issue for technology in nursing, both in healthcare facilities and classroom, is being at the mercy of the internet and power server. If either of these things go down due to weather, connectivity problems, or natural disasters, you cannot do anything. This would especially problematic in a nursing classroom setting if simulations and virtual technologies are being used and when conducting video calls or procedures requiring machinery in a hospital. Lastly, potential lack of attention to detail. Perhaps the most significant disadvantage of technology in general is that the people can come to rely on it a little too much because their tech is supposed to be the fastest, most innovative, and most accurate. They are less likely to question it or think for themselves when something seems off or inaccurate. While technology in nursing should lead to fewer medical errors, there is no guarantee that it will eradicate all mistakes. Human efficiencies and thought are still important, so nurses, doctors, and patients must remember that technology does not always have the final say. There is still plenty of room for error, and all diagnosis, treatments, and care plans should be doubled and triple checked to ensure safety and accuracy.
To discuss the impact of the assigned models, theories on the management of ethical issues in nursing practice, education, and health disparities. Marilyn embraced the notion of bureaucratic caring reveals that everything is interpenetrated by the entire spiritual ethical caring system. Spiritual ethical care, which is folded inward, links of unites categorical meanings of caring associated to humanistic and organizational entities, which may appear to be separate or independent from one another organizationally. Nurses and administrative professionals receive not just more knowledge, but also a feeling of how we may act responsibly as professionals. In essence, from a more true and holistic place to improve the health and well-being of patients, nurses, staff, and the organization armed with this knowledge. No one could have predicted how vividly this perspective is emerging among healthcare workers and others as we all develop a deeper spiritual and ethical understanding of the significance of caring and our interconnectedness locally and globally in the aftermath of the catastrophic COVID-19 virus. The current situation backs up physicists' claims, personal humility, regard for fellow sentient creatures, and a sense of reverence are at the heart of all ethics and care. The absence of respectful interprofessional communication to discern the interface between caring and technology unfolded and was the key to comprehending ethical difficulties, such as moral blindness or moral apathy among physicians, which influence positive moral decision-making by patients and their families toward the usage or possible misuse of technology within these research institutions, intensive care units. Now is the moment for professional nurses to take charge of their own destiny and mold it through theory-based practice rather than allowing others outside the discipline to do so. The ongoing study of Ray and Turkel has firmly established a link between compassion, economics, and improved patient outcomes. The successful integration of economic caring is critical for organizational survival in this competitive era of healthcare.